to speak to us on a topic on which EGROW has been interested and trying to do some research. To chair the session today, we have Dr. Arvind Virmani, Chairman of the EGROW Foundation. As you know, Dr. Arvind Virmani was the Chief Economic Advisor of our country, as well as the Executive Director at the International Monetary Fund. He has worked extensively in policy making and has published also extensively many in refereed journals. He has books to his credit, and he has been playing a very prominent role in reforms in our country. With this, I hand over the session to Dr. Arvind Virmani.
Thank you, Charan. Given the, for us it's late, so don't mind, we may have less than the usual people because normally our seminars are at 6:30 and it's 8:30 now. But anyway, so let me provide a brief introduction to the people who are here, and then we can go to the presentation. So Professor, we are happy to have Professor Benjamin W. Cowan, who is an associate professor at School of Economic Sciences in Washington State University. He is also a faculty research associate and research affiliate at the NBER. His research includes health economics, education economics, labor economics, as a whole, all the social sectors. He has referees for, I don't know, a whole bunch of journals, which amazing. I don't know how you find the time to referee all these papers, but you must be picking up a lot of stuff. Today, I guess you're going to talk about your research on the pandemic, but we would we would be happy to have your broader knowledge also, because this is not an area which we've covered extensively so far. And so hopefully maybe in the Q&A, you can also give us some broader lessons beyond your research, which our listeners maybe were not fully aware of. With that, I hand it over to you.
Well, thank you very much for that introduction. And this is a very exciting opportunity for me. So thank you for having me. I'm going to go ahead and share my screen. Okay, are the slides visible to everyone? Okay, excellent. Thank you. I should also note, if there are any questions during the presentation, I'd be happy to be interrupted. That's no problem. This is a joint paper with Kai Garcia, who is a graduate student, PhD economics student here at Washington State. So we are interested in school and childcare closures resulting from the COVID-19 pandemic. Our context is going to be the US. And in particular, we're interested in how those have affected labor market outcomes for parents of school-aged children. So school closures, both in the US and I think around the world, have been controversial over the last few years. So Emily Oster has done a lot of work in this arena and wrote in The Atlantic in the fall of 2020 about how schools are not super spreaders, where she pointed out in data that she had been collecting that infection rates both among students and faculty in public schools in the United States was actually quite low. And going along with that, there is now a substantial literature, both from the US and also from other parts of the world, suggesting that school closures have been highly detrimental to learning outcomes for children. So just to give you a sense of that, this paper in which Emily Oster is a co-author, so Halloran et al., suggests that math scores on average in the United States declined 14 percentage points over the academic year in which schools were largely closed, so 2020, 2021. But if the school district or the school remained fully in person, that was reduced to 4 percentage points. Other papers have pointed out that in addition to harming children in general, school closures disproportionately harm students from low-income families, minority students in the United States. So in fact, the COVID pandemic, because of school closures or the choice to close schools in the wake of the pandemic, has exacerbated gaps between high SES students and low SES students in the United States. Now, that the topic of how closures affect students directly in terms of their learning outcomes is not our topic today. We are doing something complementary to that, which is examining how school closures have affected parents' labor supply. There's a lot of anecdotal evidence written in popular press articles suggesting that closures have led to parents either quitting their jobs or reducing their work hours to care for children who are at home when schools are closed. That's what we'll be talking about today. So our question is, how have school and childcare closures affected parental labor market outcomes during the COVID pandemic? Okay, to give you a brief sense of the literature that we're drawing on here, and I apologize, I'm fighting a cold, so just please bear with me with my voice being a little off and that sort of thing. So early work on the effects of COVID on employment have suggested that the group harmed most by the pandemic has generally been women, and in particular women with children. So these papers in this first bullet point are consistent on that finding. Another piece of the literature has tried to explain this gap for women or mothers in particular. And there is disagreement in the literature on whether it is mainly labor demand or labor supply factors that have led to women or women with children having larger decreases in employment or hours worked. So some papers suggest it is more to do with labor demand, in particular that women or mothers were more likely to be employed in occupations or industries that were disproportionately harmed by COVID. And other papers suggest it is more a labor supply issue where women have decided to reduce their working hours or their employment levels to care for children who, again, are at home because of school closures or lack of childcare availability. We are going to come in and directly look at the question of how closures affect the employment outcomes of not just mothers, but other groups as well. And in that sense, we are trying to isolate the labor supply effects of the pandemic. Now, this also contributes to a budding literature. So first of all, going back some years before COVID, there's strong evidence that public school availability and subsidized childcare does affect women's labor supply. More recently, with school closures and the pandemic, there are now several papers that examine how closures themselves affect parents' labor outcomes. I want to just take a minute to differentiate what we are doing from some of these other papers in the literature. So many of these papers in this list here only examine the early months of the pandemic. In other words, the spring of 2020, when for the most part, all schools eventually closed in the United States, all public schools. I'm referring, of course, to K through 12 education, so sort of elementary and secondary education in the United States. And so they're using that to examine how those closures affected parental labor supply. We are going to focus on the next academic year, so fall 2020 through spring 2021. So we examine a later and longer time period over which there was substantial variation in whether school districts closed and when they closed and for how long they were closed. Many of these early papers also only use state-level variation in school closures. In other words, state decisions on what type of institutions would need to close for how long. And so they use that state-by-state variation. We are going to use much more local variation in whether schools were closed. So we look at the county level, of which generally there are many dozens or even hundreds of counties within a state, and so we're going to use a greater degree of variation in that measure of school closures than the early papers do. I should note that this last paper, Hansen, Sabia, and Schaller, actually is a working paper that came out the same day as our paper did. And it is the most similar. So that paper also uses this, it uses the same data set that we do, but there are definitely some differences in what we do and what they do. The biggest difference is that we are going to examine not only school closures, but childcare facility closures. So generally speaking, in the United States, children are eligible to go into public schools at age 5 or 6. Before that, parents would generally rely on private child care facilities for care of their children while they're at work. We are also going to look at closures in those facilities simultaneously with school closures, which not only means that we can examine the effects of both types of facilities, but also provides us some interesting ways to look at sort of examine our identification strategy, which I will get to. So summing up, our contribution is that we're going to use county level school and child care closures from a couple of papers or data sources that I'll talk about in just a minute. We're going to analyze school and child care closures together, and then we're going to examine almost basically the full school year from fall 2020 to spring 2021 in the United States. Okay, so in terms of our data, we're going to use data on essentially all adults ages 21 and over surveyed in the current population survey, which is a monthly survey of U.S. households pertaining to their labor market outcomes. Again, from August 2020 to April 2021. So schools in the United States, typically public schools, are closed during the months of June, July, and early August, and then reopen in August for the new school year. Our analysis is restricted to the subset of the sample that has available county identifiers. So to protect identities in the data, if the data is sampled from a more rural county, oftentimes that county identifier is masked to prevent accidental disclosure of that person's identity. And so our analysis, because we want to match the county that these individuals live in with what's happening with schools in that county is restricted to more urban and suburban environments in the United States. Okay, so where do we get, how do we measure school closures? This actually comes from a data set put together by Parolin and Lee, which tracks in-person visits to the vast majority of K-12 public schools in the US. So it covers 98% of counties in the country. I'll talk about the source of that data on visits or foot traffic in just a minute. In terms of childcare closures, the data is slightly less comprehensive, but still very good. So it's going to track in-person visits to about 78% of the licensed childcare institutions in the US. Notice that these childcare centers are primarily engaged in providing daycare for infants or children, so children who are too young to attend public schools in the United States. Okay, so where does this data on visits or foot traffic to school and childcare closures come from? Well, this is a data source that now many researchers are using that comes from Safegraph, which is a company that tracks visits to particular locations using aggregated and anonymized mobile phone data. Okay, so this comes from people having apps on their phone and allowing those apps, either explicitly or implicitly, to track their location through GPS. And so Safegraph collects this data, anonymizes it, and aggregates it. And so within the Safegraph data, you know for any particular school location how many people were visiting, how many unique individuals were visiting that location on a given day. So what Parolin and Lee do is they track year-over-year changes in the number of visitors to each individual school or child care facility in each month. Okay, so estimates both for 2020 and 2021 are compared to visit counts in the same month in 2019, of course, which was the last year pre-pandemic. And they consider schools to be closed if there is at least a 50% year-over-year decline in the number of visits to a particular school location. Okay, so here is a map showing, illustrating this data across the US. Now notice that there are many counties for which we don't have data because this is matched with our CPS data. So if a county was too rural to include a county identifier, it's just white here. But you can see the counties for which we do have information, and note that in September 2020, there's quite a bit of variation in the percentage of schools within a county that are closed in that month of September 2020. So you can see in places like Southern California, the majority of counties had more than half of their schools that were closed. In other areas, say like Florida, there are a substantial number of counties that have, significantly less than half of their schools closed. Now, the variation that we are going to be exploiting in terms of closures across counties is within county over time variation. So if we fast forward to April 2021, you can see that in general, many schools have opened by then, but that this varies a lot across the US. So some counties that had substantial closures in 2020 are now largely open by 2021, whereas others continued to remain closed. So this, of course, is only showing you the data for these 2 months at near the beginning and the end of our sample window. But we are going to be using month-by-month variation in whether a county's schools or what percentage of a county's schools were closed to examine the effects on parental labor supply. We're also going to control for other COVID-related variables in our analysis. So we get the number of confirmed cases and deaths at the county level from a database maintained at Johns Hopkins University, and then a number of state-level policies that I'll show you in a bit from the Kaiser Family Foundation database. Okay, so here is our empirical model and our estimation strategy. So to measure the impact of closures on employment, we're going to use repeated cross-section CPS data, again from August 2020 to April 2021. In this regression specification, Y refers to an employment-related outcome for individual I living in County C in month T. This X variable refers to a vector of individual and county level covariates. So this would be things like industry and occupation fixed effects at the individual level, and things like COVID cases and deaths, as well as policies on business closures and other things that we are controlling for in our regression here. And then importantly, X is also going to include these two variables separately. So the first would be an indicator for whether an individual adult who is surveyed in CPS indicates having at least one child ages 5 to 17 years old living in their household. That is because those are the typical ages in which children in the United States are enrolled in K-12 public schools. The other variable here, school closure, is the percentage of schools, again, in a county that had at least a 50% year-over-year reduction in in-person visits relative to the pre-pandemic baseline. Okay, so we are particularly interested in how a school closure disproportionately affects parents, which are going to be, we're going to look at women and men separately, and I'll show you that in a minute. So sorry, let me back up and say that again. How a school closure in a particular county, or the percentage of schools closed in a county, disproportionately affect parents with school-aged children, right? Because that is where we would expect the labor supply effects of school closures to show up. Okay, so that's our baseline specification, which also again includes month, year, and county fixed effects, which would account for both secular changes in labor supply and then time invariant differences across county in labor supply. Okay, so we exploit the within county variation in closures for identification of our effects. Beta 1 from the previous regression, again, is our coefficient of major interest, which tells us how school closures impact the employment outcomes of individuals with children ages 5 to 17 in particular. Now, we recognize that school closures may be endogenous. In other words, counties experiencing particularly high levels of COVID may close schools, and also they may have other policies, or just the fact that COVID is high influencing parental employment outcomes, right? And so that would be a classic case of endogeneity, reverse causality, or omitted variable bias. Our argument is that closures should disproportionately affect parents of school-age children, while it seems unlikely that other COVID-related variables would be restricted just to that particular group. So in other words, the differential effect of closures on parents is what we are going to identify as the labor supply effects of school closures, apart from any other COVID-related effects on employment. Okay, going along with this, if school closures had no effect on the labor supply of parents of very young children, in other words, those who only had children less than age 5 living in the household, it would then provide more evidence that any measured effect of school closures on parents of school-age children, ages 5 to 17, is in fact causal. So we also run the following specification, where we not only allow the effect of school closures to vary by whether there's a school-age child in the household, but also by whether there is a young child, where young is defined as less than age 5, living in the household. Okay, so our hypothesis is that if the outcome variable, say, is hours worked, then beta 1 would be less than 0, because a closure directly affects a parent with a school-aged child, but that beta 2 is equal to 0, because school closures should have no direct impact on parents who only have very young children living in the household. In other words, age less than 5. Okay, lastly, we're going to augment the previous two models with the childcare closures data that I mentioned earlier. Now, the reason that this actually isn't our baseline specification is that it turns out that in the data, not surprisingly, school and childcare closures are highly correlated across the US. So the correlation coefficient is about 0.8. And so we are somewhat concerned about multicollinearity here. Nevertheless, we think it's important to try this model as well. So in this model, we examine the effect not only of school closures on parents of school-age children and very young children, but also the effect of childcare facility closures on those two groups. So now, notice that we still hypothesize that beta 1 is less than 0 and beta 2 is equal to 0. But the effect should be reversed when it comes to childcare closures. Childcare closures should affect the parents of very young children directly, but should have no direct effect on the parents of school-age children, those who are old enough to attend public schools. Okay, so let's go ahead and get to some results. So first of all, just some summary statistics. You can see across the length of our sample period that the percentage of individuals indicating that they're in the labor force is fairly constant. In the labor force, of course, means either employed or actively seeking employment. At work refers to individuals who have been working over the past 2 weeks. In other words, they're employed and they have been at work, as opposed to absent from work, which is employed but not actively working over the past 2 weeks. Unemployed, of course, refers to those individuals who don't currently have employment but are actively seeking work. These are average hours worked in the previous week. Now notice that these are unconditional averages, so this includes people who are not currently employed, and so hours worked conditional on employment would be substantially higher than this. These variables here, stay-at-home order, non-essential business closure, restaurant limit, and bar closure, are the COVID-related control variables that we are controlling for in our regressions. And you can see that in September 2020, these are much higher than they were by April 2021, right? So by April 2021, vaccines had started to become widely available, and for other reasons, states were starting to lift many of these restrictions that you saw in the fall of 2020. Indeed, the percentage of school facilities closed in counties decreases fairly substantially from September 2020 to April 2021. Interestingly, the percentage of childcare facilities in the county actually stays about constant over this full range of our data. In terms of family characteristics, about 20% of individuals in the CPS have school-age children living in their household, and then about 5% have only young children. In other words, children only ages less than 5 living in their household. Okay, so here are the results, and I think I have about 10 minutes left, and I'll spend those 10 minutes telling you about our results. So you can see here, interestingly, that school closures. So let me stop and give you a broad sense of this table. So in the first 3 columns, we're considering an indicator variable for whether an individual is at work, currently at work, so employed and also at work at their job. This is an indicator, columns 4 through 6, of being full-time, so working at least 35 hours per week in the previous 2 weeks at their current job. And then lastly, this is a continuous variable indicating the number of hours that an individual worked in the previous two weeks. So the first column in each triplet refers to equation 1, right? So our simplest, I'll just go back and refresh your memory, our simplest specification where we only allow the effect of school closure to vary by whether there are school-age children in the household, and childcare closures are not included. And then the second column in each triplet, you can see that there's an X here for young children, so that includes the presence of young children and also its interaction with school closures. And then the third column in each of these triplets refers to the full model where childcare closures are also included as per equation 3. Okay, so interestingly, what you see is that school closures have no significant effects on the employment outcomes of individuals who do not have school-age children. Okay, so we were concerned that school closures could be associated with other COVID-related policies or happenings that would be correlated with employment outcomes more generally. But as it turns out, once we include our list of controls, there's no leftover effect of closures on individuals who do not have children. If we go down, if we go down to this row here, which is school closure times the presence of school-age children, we see that the effects, I'm sorry, I should have mentioned that this is all for women to begin with. We see that the effects are indeed negative. And in column 3 in particular, this is a fairly substantial effect of 2.7 percentage points, but it is not statistically significant at conventional levels. So we don't find robust evidence of an effect on the extensive margin of being at work for women. What we do find is a substantial effect on whether women work full-time and on their hours worked. Okay, so this effect of about 4 percentage points in terms of full-time work would roughly correspond to an 8 or 9% decrease in the probability of full-time work at the mean for women. A reduction in hours worked of somewhere between negative 1.3 hours per week and negative 1.8 hours per week would be about a 7% decrease in hours worked. Okay, and these effects are fairly similar across specification, depending on whether we include the presence of young children and or childcare closures. Okay, continuing with this table now, because again, in equations 2 and 3, we also allowed for the presence of young children, and then in equation 3, childcare closures as well. We can take a look at those effects as well. So you can see that the presence of young children itself strongly negative related to women's labor market participation and work hours, right? Not surprisingly, this would be the group. So these, again, young children here are defined as ages less than 5. So this would be the typical time when women were taking time out of employment to care for very young children. However, that effect does not vary systematically by whether a school is closed. And that is what we would expect, given that school closures don't directly affect women with very young children because they're not age eligible to go to public school yet. Okay, so no systematic effect of closures on women with very young children here. Now, with equation 3, where we add childcare closures to the mix, you can see that, again, childcare closures have no effect, generally speaking, on women with school-age children. And again, that's what we would expect given that they have no direct effect on school-age children because they are age eligible for public school. But there are negative effects of childcare closures on women with very young children. Now, again, these are not estimated precisely. This is a very large effect, right, of 12 percentage points in terms of full-time work and an effect of 2.4 hours per week on average. Nevertheless, none of these effects are statistically significant. Again, that may be partially due to the high correlation between school and childcare closures. So we may be seeing somewhat inflated standard errors here due to multicollinearity. Nevertheless, in terms of signs, these effects are consistent with what we expected. Okay, so I realize that I'm pushing up against my time limit here, and I will try to speed things up just a little bit now that you've gotten a sense of kind of how we're showing the results. Interestingly, what we find is that the effects on employment in general for men are actually quite similar to the effects for women. We weren't expecting that. We thought the effects would be larger for women, and in some cases, which I'll show you in a minute, they are. But overall, you can see that the hours effects on men in particular are quite similar to what we saw for women. Although childcare closures have no particular effect on men, even if they are fathers of very young children, which suggests that women are largely bearing the burden of a childcare closure with very young children, even though fathers do seem to share in the burden in terms of labor market outcomes when it comes to school-age children. Okay. We also want to examine our results across a couple of dimensions. One is marital status, and the other is parental education. I'm going to, in the interest of time here, I'm going to skip the marital status results, and I'd be happy to come back to them in the Q&A if there's interest. I'm going to focus on the parental education results because this is for a couple of reasons. One is that parental education is strongly related to occupation and industry. And we know that certain occupations and industries were harmed much more by COVID than others. We also know that parents with higher education tend to be in jobs with more flexible hours and a greater ability to work from home, which would, certainly be correlated with the ability to look after a child involved in online schooling while you're also working. Lastly, parental education is obviously correlated with income, and there is some evidence that wealthier parents switched their kids from public school to private school, which in many cases were not under the same obligations to close when public schools closed. And so for all those reasons, we expect that the effects to differ by parental education, and in particular that the effects might be more pronounced among less educated parents. So let me show you those results. Okay, so this is the results for individuals with a college degree or more. And what you can see is that the effect of school closures on parents of school-age children when the parents are highly educated are actually much smaller. So for women, there are no significant effects. For men, we actually do pick up a significant effect on a decrease in full-time work, but notice that the effect on hours worked in general is very small. That stands in contrast to less educated individuals, where we find large effects, both for men and women, in terms of hours worked, of something on the order of 2 hours per week. And then for women in particular, a very large reduction in full-time work corresponding to a large increase in part-time work if they have less than a college degree. Okay, again, in the interest of time, I'm going to skip over a few sensitivity analyses that we did to essentially examine whether our results are robust to different definitions of a school closure. But generally speaking, those results are robust, and I can come back to those if anyone would like. So let me just conclude and then open up for Q&A. We find that parents of school-age children are less likely to work full-time and reduce their hours per week in response to school closures. It seems that with more time to adjust their schedules and anticipate closures starting in fall 2020, so this of course is several months after the beginning of the pandemic, we find that the additional childcare burden brought on by school closures was more balanced across gender. This would stand in contrast to the early months of the pandemic when women seemed to bear almost all of the burden of the additional childcare responsibility. Maybe most importantly for our results, we find that parents without a college degree were significantly more affected in terms of work hours than college graduates. This adds to the evidence that COVID and school closures in particularly have disproportionately harmed the least advantaged individuals, right? Where it seems that kids from low SES families were experiencing the largest decreases in school performance resulting from school closures, and we're adding to that evidence by suggesting their parents were also experiencing the worst labor market consequences of COVID as well. And so that's certainly important to take into account for not only the current pandemic, but planning for future ones as well. And I will leave it at that. And again, I'm happy to take questions or comments. Yeah, so I'm happy to call on people, or would you like to moderate it, Dr. Virmani?
Yeah, first, Charan, do you have any comments or questions?
Yes, I do have. I really find the study very interesting and very meaningful. So, Professor, I had two questions. One is, I've seen that it doesn't have a gender bias, but I wanted to know whether you have, in your sample, you have isolated single parents, and did they show a bigger impact, or and then if the single parent is mother-headed household or father-headed household. The second thing, Professor, as you know that there were lots of layouts during this time, and I'm sure in the sample also layouts would have reflected. And what all we have noticed in India, given the Indian context, as well as read about America, that the layouts were large and therefore the doles or the unemployment allowance was very high. Um, how does that get factored in your analysis? Thank you.
Just add one more question. You can take up the three.
Okay.
I'm not clear what is the implication. I mean, you're drawing. Why is it that less educated? Is that working on the demand side or the supply side? I'm not quite clear. How you when you differentiate by education. So just these 3 points.
Yes, thank you. Great questions. So let me take those in turn. So I'm going to go back now, given Charon's first question about single parents, and show you the results by marital status. Single parents are a very interesting case, right? Because there's less flexibility with regard to sort of interacting with a spouse and sharing the burden of childcare when schools are closed. That would particularly fall on mothers, given that the vast majority of single parents in the United States are mothers. And so we also did want to look at that. When we do, we see that for married individuals, the effects across gender are quite similar. You can see here, so, reductions in full-time and increases in part-time, and then reductions in hours worked are pretty similar across gender. So in married couples, it seems to be the case that at this stage of the pandemic that we're looking at, that those burdens are shared in married couples. When we look at unmarried couples, we do find, at least when we look at the statistical significance of results, that women are bearing the larger burden in terms of labor market outcomes, right? So we get the substantial reduction in full-time work and statistically significant decrease in hours worked for single or unmarried women. It is interesting that even though there's really not much going on here in terms of full-time and part-time for men, we see this large negative effect on hours, again, even though it's not statistically significant. We're not really sure about that, other than to say that, again, this one is imprecisely estimated, whereas this one is. And so, we feel comfortable saying that, the most robust effects in terms of single parents seem to be on women. And so hopefully that speaks to that question, and feel free to ask a follow-up. In terms of layoffs, it's another great question. The vast majority of layoffs in the US, from my understanding, occurred in the spring of 2020. And by the fall of 2020, the labor market in general had rebounded to a large degree, though certainly it still was depressed relative to pre-pandemic levels. When we think about how layoffs affect our particular results, our main thought is that if layoffs in a particular county are correlated with school closures in that county, then we should be picking up effects in this term here. In other words, those should be constant, generally speaking, across parental status or across whether people have school-aged children in particular living in the household. In other words, any differential effect of school closures on parents of school-aged children, we are going to chalk up to the labor supply effects of closures in particular. So if layoffs were confounding our results here, it would have to be because they were affecting the parents of school-aged children more than those who are not in that group. So that's how we're handling that. Lastly, the question on what's going on behind the results by parental education status. So, in particular, what's kind of behind this? We a priori, we weren't sure what to expect here, because if a parent has a less flexible work schedule, then theoretically, we think that could mean that they are less likely to reduce their work hours when schools close, or more likely, right? So if they have to be to work during certain hours and otherwise they lose their job, it's possible we'd see a smaller reduction in labor market outcomes for low educated individuals who generally have less flexible schedules. At the same time, if their schedule is less flexible such that they have to change jobs in order to accommodate having a child at home, then we might see a bigger effect on their work hours. So the fact that we do find a larger effect for individuals with lower education, to us, and this is just hypothesizing, because we don't have a way of analyzing this, at least that we've thought of directly. We're hypothesizing that parents with higher education and generally more flexible work schedules were able to spend some of the time during the school day helping their children with their online schoolwork, and then shifting some of that work to off-school hours, right? So to evenings, for example. Whereas less educated individuals were probably less likely to be able to do that, given either the need to be at a physical location for their work that was not their home, or because their hours were just in general less flexible than parents with higher education. So that is our best guess as to what's behind this, but certainly happy to hear any thoughts that you have on that.
Yeah, so no, I was just wondering a little broadly, with all the other variables, is there any sense that the occupations or the like we did some work on epidemic, and we divided into 3 sectors, which was what we call contact services, which were more affected. So is there any sense that there's an, correlation maybe with the less educated or the more educated by the services or jobs which would be more affected by contagion fears, basically, contact services? That is a segment we analyzed in India. So that was the thought behind my, but if you don't have evidence, that's fine. I just was wondering if you have some information.
Yeah, that's an excellent suggestion. So that's something that we've thought about doing and haven't as of right now, but I think your comment will sort of reignite our interest in doing that. We could cut the results by occupational characteristics. So work flexibility, ability to work from home, COVID related risk, and see how the results vary along those dimensions. And that would help us to get at this question of how education is affecting these results. So I thank you for that suggestion.
So yeah, I mean, you got it, but just to repeat for the audience. So basically, for those who are working in, who have children and have a job which involves a lot of contact, they may be fearful of bringing that virus home, so to say, and infecting their children. So that's kind of the thought. Okay. So Charan, do you see any questions on the chat board or
Yes, I
Sir, may I
understand
ask
there is.
yeah, who is that?
Professor
Yeah, go ahead.
Kuldeep Kaur, sir?
Yeah, go ahead.
Sir, first of all, let me congratulate Dr. Ben for giving a relevant presentation for it. It's not just a question, but these are just the observations. Dr. Ben, don't you think that the women are, from the women's side, they are more affected as compared to the men? And you have given this hint in your findings as well. And also along by single parents, I think that the single women, single mothers are more affected. And my second observation regarding this is that, as Professor Virmani has already said, that there are sector to sector variations regarding the labor supply. Till date, we can find many companies or many sectors where even if the COVID period is over, these companies or the sectors still prefer the people to work from home. Because by this they can have the cost cutting, they can use the cost cutting strategies, as well as some other aspects are in consideration. So don't you think that these factors might have also worked regarding the affected labor supply during that period even?
Thank you for those comments. It's absolutely true that depending on one's occupation or industry, that job requirements in the wake of COVID started to vary substantially, right? So some workers were designated as essential and essentially didn't have the option. If they were going to continue working, they had to show up to work. Others were strongly encouraged or even, essentially mandated to work from home. And so I think it's a great idea, building on the last comment, to examine how our results vary by those occupational characteristics. There's a lot of good work now that shows, how certain occupations were affected not only by COVID risk, but also in terms of how flexible hours are, how flexible the work arrangement is, and we can draw on some of those studies to help us here. In terms of I just a general comment about this. I view this as potentially mediating the effects that we are seeing in terms of school closures, rather than being an omitted variable problem. Again, because we wouldn't necessarily expect those effects to be or you know, those work related issues to be correlated with school closures, or if they are to only affect parents of school age children. So you know, I think that there's probably important heterogeneity in the effects by occupational characteristics. But again, if you sort of buy the story that school closures should only should only affect those with school age children, which is what we're seeing, then I think we're still safe from the concern that in general, what we're picking up is the effect of an omitted variable. But you know, again, it's only good as far as you believe the assumption about.
Yeah, I think, yeah, thanks. There's the last question, Mr. Asim. I think Asim Shakir.
Yes, sir. Yes, sir.
Yeah, go ahead.
Professor, I really liked your research. I had one question. Have you considered the effects on parents who have younger kids, like in the kindergarten or in the lower grades, compared to the kids in higher grades? Have you considered the effects they have on parents?
Yeah, so kind of to add to that, I was also wondering that in some sense, parents may just leave the kids who are slightly older at home. They don't have to worry. So maybe in that group up till whatever age, I don't know what age, there may be more effects. So yeah, same question.
Yeah, great point, great question. This is also something that we've thought about, and we still need to do. So I'm gonna take that suggestion and analyze, cut the results that way, because you're absolutely right. We could see different effects by depending on the age of children within the school aged category of children. Interestingly enough, just one data point, but the paper I mentioned earlier, this paper right here by Hansen, Sabia, and Schaller, which again is the one that's most similar to ours and came out the same day. They do cut their results by child age, and you certainly have to ask them about their results. But it is interesting that, if anything, the effects for parents of teenage children, so say ages 12 or 13 to 17, are at least as strong as the effects on parents of younger children. So that is not intuitive in some sense, because you think older children are more capable of being left alone. Though certainly parents may also worry that they could get into more trouble at home alone. So it's interesting empirical question. We need to look at our results that way too. I definitely agree.
Okay, thank you. Thanks a lot. I guess we have kind of run out of time, so let me hand it over to Charan to conclude the session. Thank you. Charan?
Yeah, sir,
There's
there
one
is
more
a
question. Shalini, do you want to take that quickly?
Yes, sir, I'll take it quickly.
Yeah,
Thank you so
Shalini.
much, Professor. It was a very nice presentation, very nice work. Just one question was coming in my mind. Did any fallout of school-going children on long-term basis take place? Like you're saying that it was related with the earnings, etc. So did it happen that certain students took away from the school, and do they have a long-term basis, not continuing education? Was that effect taken anywhere?
Let me make sure I understand your question. So you're asking on sort of long-term effects of children's school enrollment resulting from school closures?
Yes, but it is more towards the fallout of school-going children. So, because of the closure, we all know the schools went online, but there might be certain students who might have fallen out of school because the parents were not able to afford the school, maybe.
Yeah,
Because
so
the earnings is also important.
Dropout. I guess she's talking about dropouts in schools. Yeah.
Yes, I'm talking about the dropouts.
so we are not looking at this question directly, although there is work suggesting that in the U.S. there has been a substantial number, I don't know off the top of my head, of children who have essentially have been lost to the school system, right, as a result of online schooling, where they disenrolled and have not re-enrolled. One particular way that your comment actually pertains to some of our results that I failed to mention is that another reason why we see the very different effects by education level of the parents could be that parents with higher education were simply able to put their kids in private school or other forms of private care during COVID that were not financially available to parents of lower means, right? So that is another very plausible explanation for the effects that we see across parental education status. So thank you for pointing that out.
Okay, thanks a lot. John, why don't you conclude?
Very interesting presentation, Ben. And Professor, we've liked your presentation. You've seen from the questions. There are many more which are coming over to me. And one of the questions, I'll just mention it to you. Maybe you want to answer. Maybe we'll take it. You want to take it as a suggestion. And that question is, once there was flexibility in working hours, then would the wages have gone down automatically because flexibility has brought in? And that could be one. And what is that you find in earnings per hour? The second is, as the commuting time or the commuting cost was cut out and people who are working online, maybe the demand for work or for better wages was not there because you were already saving on commuting, and therefore lower wages were accepted or lower earnings per hour were accepted. So I think your research throws up such excellent thoughts and ideas, and I think that's very important for the labor market. I don't know if you looked at these two issues. If you have, fine. If you haven't, maybe as suggestions for the future research.
Yeah, that's an excellent point, and I will take that as a suggestion for future research. We are involved in following up on this initial work on labor supply by examining. We do have plans to examine what happened to earnings as a result of school closures, and I think that some of the pathways that were pointed out in that comment are very relevant. Another strand of what we're interested in doing is looking at college enrollment for graduating high school seniors, as how that varied by whether schools were closed in their junior and or senior years of high school, and that certainly has implications for long run earnings as well. So yeah, that's a great suggestion for future work.
So I must thank Professor Ben for accepting our request and speaking from just across the world. He's in Washington State, just across the world. And we are 12 hours. 12 and a half hours away from each other. And then we are in the almost middle of night, I would say, 9:40, and you are starting your day. Must thank you. The recording of today's presentation will be available on our website by noon. We'll send you the link. I'm sure many more people who would have generally joined us today and because the late hour have not been, they will benefit. I'm sure, Professor, with this presentation, many others at your end would also benefit. I have an important announcement to make. Next Friday from 2:30 to 4, we have Dr. Anup Singh, who was formerly at the International Monetary Fund. He was heading the Asia region department, speaking to us about his new book, Asia in the Global Economy. And I think that is a burning issue, Asia in the global economy. And I'm sure he will have to answer questions on Sri Lanka and Bangladesh now, and would be a very interesting discussion. The time is 2:30 to 4. We'll send you the flyer. We would request you to please join us next Friday to continue benefiting from the research-based policy think tank that we are. With that, once again, thanking all of you to be with us on Friday. I thank the chairman for taking time out, late hour, and chairing the session. I thank Professor for taking the time out and speaking to us right in the beginning of the day. Thank all the people who asked questions and participated so actively in this seminar. Thank you very much.
Thank you so much for having me.
Thank you, Ben. It was a great, great pleasure.
It was. Thank you.
Thank you.